Welcome back. President Trump taking aim at the soaring cost of prescription drugs in a speech at the White House this afternoon.
In the coming weeks, we will work with Congress to pass legislation that will save Americans even more money at the pharmacy. For that, we need the help of Congress, and we think it will be forthcoming.
Well, Senator Bill Cassidy of Louisiana attended the speech. He's here with us now. Senator, welcome.
Hey, thanks for having me.
You, in fact, do have work in Congress, bipartisan work, we should add, as everybody thinks, such a polarized age. What is the HELP Act, and does it jive with what the president just announced today?
Yeah, so we're doing several things in healthcare. One thing we're trying to push for price transparency. That absolutely jives with what the president is speaking of today. Someone getting a prescription or getting a blood test or x-ray ordered should know the cost of that before she has it done and be able to compare with getting that prescription or blood test or x-ray someplace else. The president is all about that. Removing gag orders so that the pharmacist can tell someone that her prescription would be cheaper for if she paid cash as opposed to paying her insurance copay. There's a lot to like in this bill and what the president proposes.
Yeah, we looked at the reaction, of course, of the health industry to this announcement. Now, you initially saw some pressure across these stocks, Senator, especially some of the pharmacy benefit managers, the drug distributors, and those parts of the chain that it sounds like they're trying to put some pressure on. But then they recovered. They closed higher in many cases. And do you think the industry should be shrugging this off?
I actually think this is fair. There are no bad industry players. There are just incredibly bad incentives. And each has a role. For example, pharmacy benefit managers, in some way their role is expanded as the administration suggests that some drugs under Medicare Part B can now be negotiated under Medicare Part D. That's an increased role for PBMs. Elsewhere, it looks to see whether or not the rebate activity, the secret agreements between manufacturers and insurance companies, should be trimmed back. But PBMs were created to negotiate. Their role is preserved. What should be trimmed back are secret rebate deals, which probably cause the consumer to pay more. I actually think it's fair to all the players.
Senator, I'm sure you've heard, that whenever this kind of thing is brought up, various people from the industry say, well, it's very complex. We can't just have a straight list price, and we don't know all the reimbursement rates, and there's all these reasons along the way to create these incentives and all the rest. So can this actually cut through to that, and do you think it's a good chance of passage?
I find that when people complain about the principle or the complexity, what they really mean, they're going to lose money. And at some point, you got to take a sledgehammer to it. I think the president's trying to do that. If you list a list price, yes, that includes a rebate. But the president is speaking about eliminating rebates, in which case the list price should go down. So I think there's kind of interlocking features here which make it fair to pharma. If you advertise a drug, tell us what it costs. If you're paying more because of a rebate, let's get rid of the rebate. Then see what it costs. And I actually think that creates a dynamic, a pressure to do the right thing.
Gilead, I know, has been a contributor to you, Senator, health professionals in general. Is that because they're concerned about the direction this legislation might go? Do you think that they will be helped more than hurt by this, by all of this talk about regulation? That it's just not going to have that much bite.
I can't speak about a specific industry, but one provision they are looking at, for example, Gilead produces a drug for hepatitis C. As I looked at hepatitis C in my own state, I'm a liver doctor, I looked to see that if we could get a drug from Gilead or another provider of hep C medicine at a certain price, we would save money buying it over the 30-year period that the patients would benefit because of fewer liver transplants, fewer patients dying of end-stage liver disease. And so in this proposal, they speak about long-term financing provisions, something I've been working on, frankly, with Gilead, Merck, and others. If the president is interested in making that happen, we will create access to medicines for things like hepatitis C. More Americans will live, taxpayers will save money, but it opens up new market opportunity for pharmaceuticals. I think it can be a win all the way around.
Understood. And final question, Senator, before we let you go, HHS Secretary Alex Azar himself said in his question and answer segment today, he said, we are restructuring an entire leg of the U.S. economy. Does that make you nervous, that kind of talk coming from Washington, or is that exactly what we need right now?
We need that. There are so many incentives that benefit the pharmaceutical industry, the PBMs, the insurers, but don't benefit patients. And patients are getting hosed. As a doc, I want that patient to do better. We need to restructure it so that she is first, she has the power, not other players in the industry.
All right, Senator, thanks for your time today.
Thank you.